come in from the front and I palpate the intercostal spaces and I have her just breathe. And I go, can you breathe into my hands? I want to see if they move and separate or they are blocked. And so I think this is blocked and painful, and so is this. Yes. I can bring your arms up all the way, reach up to the ceiling. I place my hands here, you drop your arms. Relax your shoulders. And now it goes, yes. So exactly the upper ribs are not moving well. The pec minor, yeah, we're not friends anymore. But
can you do that?
that's right.
We never were.
So I can feel the ribs and I can ask her, breathe, relax your shoulders, breathe. Yes, and I don't feel much movement. I come round to the side, breathe. Yes, here she can breathe quite well. And I can come down, breathe. Yes, she can breathe quite well. So I can come behind her chest, breathe, and she can breathe quite well. So many times it is this pec minor area that will not in the front open to expand. So I have an idea that this area of the rib cage is stiffer, will not move. Now, I can now do, I will finish with the ribs. So you will lie on your side and scoot up. So she's good. And what I will show you on the other side in a moment. So I'm going to go from rib cage to rib cage. Give me a second here. So, okay. Okay, so we've done. I'll come back to that in a moment. Yes. So we've done a little bit of that. I've looked inside, I looked at the top, and I'm looking, I'll come to that, I'm doing this now. I'm looking for separation of the ribs on inhalation, exhalation. So there are two aspects of the ribs. It's excursion, and then there's separation. So I need to know if she can separate the ribs in breathing. So I'm going to place my hand between 2 or 3 ribs, and I'll ask her to breathe in. And I see my thumbs move. Again, breathe in. Yes, my thumbs move. Breathe in. My thumbs still move. Breathe in. My thumbs still move. Breathe in. My thumbs don't move. Okay? So turn to the other side. So this is in keeping with my findings. And now you will see. I relax my hand. Breathe in. You see my thumbs move. Breathe in. My thumbs move. Breathe in. My thumbs move. Breathe in. My thumbs are not moving so much. Breathe in. My thumbs don't move. They excurse, but they do not move apart. So here, tender, here, tender, here, tender, here, tender. These areas that do not move will be tender. So now I have assessed the rib movement in the front and in the back, the upper part. Lie on your back, please, or you can do it in sitting. And we can also just go, okay, breathe in. And I feel that these move, so there's no problem with that, yes? So I have an assessment now of parts of the rib cage, what is stiff, what is not stiff, where do I focus my treatment, and where I can give the instruction for the patient as a home exercise to focus her breathing mobilization. Yes? So this has given me enough information to start to get a home exercise program that will be focused on what my findings are, not just telling her you need to breathe abdominally, because obviously she can do it pretty well. She needs to breathe in her chest and open these parts up. That's it. So I've done that. Now we can do I can do the diaphragm test in supine. If you want to do it in sitting, you do it, but I can do it in supine. And I'll have her breathe in, and I want to see now if she breathes all the way towards the groin. Good, okay. And then I go breathe in, breathe out. Don't breathe. Can you push my fingers apart? Push, no, don't breathe in. Don't breathe, push my fingers out. Push, 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 push. Can she do that? Okay. So she can brace there. Okay, breathe in, breathe out. Good, it moves. Breathe in, breathe out. Don't breathe, push my fingers out. She can use that. Push it, hold it. Yes, okay, good. Okay, so I know that she can breathe into that area, she can brace into that area. That is not a problem. So, now you can turn over and lay face down. And now, pelvic floor. I can use I can go up the medial ramus, and I can have her breathe in, and I feel, can you breathe against my finger and breathe out? Breathe in, not so much. Breathe out. Can you take a small breath in? Don't breathe, and push that breath against my yes, good. So that she can do. And on the other side, can you breathe in? Yes, this side she breathes against my finger. I feel it. This side, she's not so good. Is this at all tender?
Yeah.
Yes. And is this side tender?
Barely.
Barely. So you are collecting information that will be in keeping with what you do, how you instruct the patient, what your manual therapy will do. So you're not guessing and going, oh my God, you know what, why don't we just have you breathe deeply? It's not really useful. So now I know this side needs work. So I'm going to use contract, relax, or PIR. Try to breathe against my hand, or you can try to push my finger away. Brace, 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 push, push, yes, and relax. And I let the relaxation take the pelvic floor up, and I release it. Take a breath in, stop, push my finger away with that breath, yes, like a ball, and hold it, relax, and that goes good.
So are you doing something with your fingers and the
Yes, I follow. She pushes against me, that's a contraction. Relaxation, I stretch the pelvic floor. Yes, I let it go up and I stretch it out. Good. So she's getting tactile information of how to feel that side, and she can let it activate and relax it, which is the two things she must have. Okay, now breathe against my finger and breathe out. Yes, this is better. Okay, so we can do that. We've seen the diaphragm. We've seen the diaphragm work. We've done some work with the pelvic floor, and I can remember that the left side of the pelvic floor needs my attention, and that she should try to breathe against that for treatment. And now I have to treat the ribs. So since it is these upper ribs for the most part, I have to know which muscles take these ribs as insertions or attachment points. Pec minor, pec major. Latissimus dorsi a little bit, but serratus, those three muscles will move these ribs for me. So I can use those three muscles to mobilize the ribs. Yes? So she will lie on her side facing you.
Do you want to
Hmm?
Do you want to do that now, or do you want to have them just kind of assess the rib cage and
Yes.
bracing breathing?
Right. Let us do this.